And the spine, as you recall, is made up of these individual bones that are called vertebrae that are stacked one on top of another. And it serves a multiple functions of support. It also allows us to move, and it also serves a protective function because the spinal cord is actually transmitted from our brains down through a tube that the individual bones form when they're stacked in this fashion. And each vertebrae is separated from each other by a little cushion called a disc. The body takes advantage of that separation and gives off a nerve right at the level of each disc to go to travel to more distant parts of our body to provide innervation. In our lower back, these spinal nerve roots all primarily go down our legs. And that's unfortunate in the sense that when something happens here, we tend to feel it not only at our backs, but it radiates in the distribution of the nerve itself, which oftentimes goes into the legs. So what we see in the MRI that we took back on January 5th, in your case, is between this base bone here of the back part of the pelvis called the sacrum and the bone that sits directly on top of it, which is your L5 vertebrae. We first off have arthritis that's settled into the joint. The joint is where the bones are joined together. You can see it right here where I've got the tip of the pen. And when there's arthritis, not only is there inflammation present in the bone, but the bone starts to thicken. And unfortunately, when that bone thickens, you can see it's positioned right in front of that nerve that travels down the leg. And that can sometimes pinch the nerve. And that causes the sort of pain and discomfort that we often experience radiating down our legs. We have that present here in these joints between the fifth lumbar vertebrae and the sacrum. That's that triangular shaped bone that I was just explaining. And also at the level directly above it between L4 and L5. Additionally, one of the problems that we have is that the pedicle is considered congenitally short in your spine. The pedicle is best seen when we look at it from this perspective. It's this area right here and right here that basically forms the walls of the canal that the spinal cord is traveling through. So we basically are, the room, if you will, or the tunnel that's formed has an abnormally low ceiling as a result. So we have less space here. Over here on the side, this space where the nerve is passing through is likewise smaller. And finally, we have the discs down here and down here that are bulging, meaning the covers have grown a little bit weak. And when they bulge backward, also right toward the nerves. So the problem that we have, though, is the treatments that we normally would do for that have not been very successful for you. We've flooded both the interior of your spine with a numbing medication as well as a anti-inflammatory. Additionally, we've treated the joints individually where you have the arthritis. And in all three cases, as you were telling me, it seemed to make things worse as opposed to making things better. So that's kind of where we are for the moment in terms of what we're doing. We're obviously using some bracing, trying to get some better control and unload some of the stresses on your spine that way, give you additional support. But we're staying away from medications, as you pointed out, for the time being, trying not to go too far down that road, which can also have some unwanted side effects in addition to providing some relief. But in terms of other types of treatment plans, certainly something like a spinal cord stimulator, which we were just talking about a few minutes ago, where there's an implantable device that actually provides electrical stimulation directly at the level of the spine, is another consideration, as well as physical therapy.